Hey everybody, we're back again. So today I want to talk about some of the factors that affect blood glucose. Because a lot of you probably think, well, my food, my exercise, my medications, all of those do, but there is a lot more than that. It's actually quite a long list. Some people say 42. Very wonderful writer on the website tcoyd.org originally came up with a list of 42. I believe that's expanded to somewhat over 50 at this point. So I definitely do recommend going to tcoyd.org and taking a look at that. It's kind of interesting. But there's a lot of things because people will tell me all the time, why does my blood sugar, I've been doing everything the same. Why is it changing? Why is it changing? I can't figure it out. Because there's a whole lot of things that can affect your blood sugar. So, like I said, first of all, it's your food. Did you eat more food than you thought you were going to? Did your food have more fats in it than you realized? Do you realize that the fat content or the protein content of your food can make your blood sugar go a little higher and stay higher than a lower fat meal? So again, that's one of the things that we're going to talk more about in depth in sessions to come. But just remember that as something to take into consideration. Physical activity, it certainly does. If you are being less physically active than usual, more physically active than usual, but sometimes it's just about what kind of activity are you doing. Cardiovascular exercise, so things like swimming, walking, riding a bike, those can lead to low blood sugar more immediately, while when you're doing strength training, so lifting weights or anything, resistance exercises, that can actually lead to high blood sugar initially, but then you'll see that blood sugar drop back down much closer to your target and probably stay there a lot longer too. And the reason I mention that is because people have said to me, well, geez, Heather, I'm doing this exercise and my blood sugar goes up. Why? So then they stop exercising. Well, that's why. It's just because of the way muscles are working and pulling blood sugar in and that kind of thing. So it's a good thing. Don't stop doing it, okay? And then there's medications. Did you forget your medication? Timing of day. And this could be something that needs to be sort of experimented with for some people, depending on what kind of medication you're taking. So something to talk with your healthcare provider about. Maybe it could be something that you're taking for a short period of time, especially steroids like prednisone. Suppose you've got poison ivy or you've got an upper respiratory infection. Your provider gives you some steroids. So if you haven't ever had steroids and you have diabetes, your blood sugars will go sky high. And if you have diabetes and you've had prednisone prescribed, your blood sugars are going to go sky high. It can be really worrisome. And talk to your healthcare provider about it. For most people, that's only going to stay high for the short period of time that you're taking those steroids. But some people need to take those steroids for a longer period of time. So you definitely need to have a plan in place for how to manage that. And those are just some of the obvious things that can raise blood glucose. But there's a few more that people just don't ever think about. One of them is caffeine. And there's a lot of different thought processes out there about that. But there are many people that actually recognize that their blood sugars will go up if they have coffee or caffeine in another form. And some people say it doesn't have any effect on them whatsoever. A big one is sleep. So this is not enough sleep. This is poor sleep quality. This is sleep apnea. If you have sleep apnea and it's not being treated yet, all of those are going to make, any of those are going to make reaching your glucose targets really difficult. Sleep is so important. So if you have, if you're having any of those issues, again, talk with your healthcare provider about ways to work on that. And it doesn't always have to be medication necessarily. Maybe you are just having more stress or anxiety than usual, or you want to try some meditation or something along those lines. But just make sure you're talking to somebody if you're having a long period of time where you're not being able to sleep really well. A lot of other things that can affect glucose levels, whether it be going high or low. And again, it's going to be all dependent on every person's metabolism. Smoking. So smoking, again, so this is just one more thing, one more reason that if you are smoking and you're having, maybe if you're considering smoking, talk to your healthcare provider, because it's just one more thing that can make managing your diabetes more difficult. For women, menstrual cycle can elevate blood glucose levels. Sunburns, the actual physical stress of a sunburn can cause high blood sugars. Prolonged stress, and this is, stress over several weeks, and it's stress over and above, like, ooh, I've got a big day at work, or I've got a big report at school, something to do, so I'm stressed about it, getting it done. That's kind of the good stress that motivates us to do our best. So this is more like stress, like that you're not able to sleep well, or your head is racing all the time. That can really elevate blood sugar levels. So again, that's sometime when you need to reach out either to family, to friends, to your healthcare provider to figure out how to manage that better so that you can feel better and get your diabetes where you want it to be, because high blood sugars, again, that also doesn't make you feel good. So now you're sort of building one thing on top of another. And don't forget, there are all of the healthy things that you do for yourself every day. Those are factors that affect your blood glucose. So taking your medications, managing stress, sleeping well, just being good and kind to yourself, those are things that help manage your blood glucose levels. Those affect your blood glucose levels. But I told you, this was a pretty long list, and that was not a very long video. So we're going to have more on that, especially some of the ones that really have big impacts in very different ways coming up down the road. So keep watching, because really the thing I want you to remember is that there are so many things that affect blood glucose. And it can happen throughout the day. It can happen from one day to the next. And not all of those things are something that you're going to be able to actively do something about, which is why it can be so frustrating for people with diabetes to be, I'm doing the same thing. So what's different? Well, sometimes it's not always easy to figure out. And sometimes it's something that you can't actually do something about. So it's not you. Just trying to, again, find that learning curve. What could it be? And taking care of the things that you are in control of, which is just you. And again, that's being kind to yourself. Don't beat yourself up for things that might not be able to do anything about. So I'll see you next time. We got many more stuff to come. Have a good day.